Rachel, wave!
Hey!
Can I stop you for a second?
Yeah, of course you can.
Okay, awesome. Hello, Rachel.
Hello, it's my first time in a golf buggy ever.
Me too.
Wow.
And I'm in such great company.
I know. I know, it's great to be with you.
It's absolutely lovely to be with you two here in Reading at a fabulous location that you found for the OpenEHR Annual Conference.
Absolutely, an old house and a new conference centre, so a bit of both.
Yes, awesome. I learned one very interesting thing, among other things,
Go on, tell me.
Yesterday. So I didn't know
Yeah?
that 30 years ago there was already this initiative about the good European healthcare record,
Yeah.
which kind of sounds very similar to me to the kind of joint European patient records
Yes.
that we're trying to work on now.
Yeah.
Why is history repeating itself? What's different today than it was then?
Oh, so we're very different today. So 30 years ago, data was really for humans to read in letters or on a screen. But today we're in the age of kind of cognitive intelligence, AI and things like that. And so now we really understand the importance of data. And now we're in a position to do things like home-based pathways, remote pathways, patients doing self-care. Back in those days, we weren't ready for that, and so data wasn't so important. So it is really top of people's agenda now, whereas back then, it didn't matter quite as much. All the hospital care was just done in the hospital, really.
Do you think we've learned anything from that project? Because when we talk about the European health data space, there's a lot of projects that kind of have led to this moment.
Yeah.
So it's not like we're building everything from scratch since 2024.
Yeah, I think we've learned a lot in the last 30 years, and there's a lot of lessons learned from doing things certain ways or, what has or hasn't worked. And, I feel that we have to kind of learn as we go. So the last 30 years have been valuable, but actually now that we're moving into this cognitive space, that's really important because it's actually pushing the agenda of data. Sorry.
No problem. The discussion here is obviously centered around data and data standards. And I think that in the last maybe 2-3 years, there's been less of this kind of battling debate around whether or not FHIR is better than OpenEHR. There's a lot more collaboration. So how do you see the discussions around data, and what are you missing in these discussions?
So I think between the standards bodies, all of them, we have what we need. We just have to work out who does what. So for me, say FHIR and OpenEHR, I've always run the two of them, right? They've always coexisted for me. And I think there was duplication, there was overlap, to a degree in the past, but we're both deciding we're not going to do those overlap things. We're going to complement one another. The much bigger prize is getting healthcare right and saving lives and improving lives. And I think everyone is behind that now. I think the standards bodies are matured as well, and they understand what they're about, and they understand what their identity is. So for me, it really feels like a very opportune environment where everyone is working towards the same goals, everyone's having really, constructive discussions. So again, when standards bodies start, they have to find out who they are, what they're doing, what they're about, and now they know, and now they're ready to complement one another and work out what they do and what they don't do.
So what do you think is the next step that needs to happen to kind of drive progress forward? One thought that stood out most to me yesterday was when we talk about open standards and working together, this can't be possible if communities are kind of siloed, similarly as data is siloed.
Absolutely. Communities need to have a governance that will allow everybody to have a say, and that, discursive debate to happen and the right thing to, come out from decision making. For me, we need those communities of practice. We need standards bodies to actually allow this to really be democratized, and the members to be able to decide what is going to move forward and what's important. And I think we're, pretty good at that clinically with OpenEHR. That's one of our strengths. But I think we're all going to have to kind of work together. My ideal outcome from this as a former CIO is like really practical how-to guides for on the ground, So, a number of standards bodies, and you heard yesterday from SNOMED that we're planning, joint implementation guidance. We should be aiming for that from HL7. It's to say, okay, health system, this is how you can use the standards together to get the best outcome for your population. So I'm really delighted we're talking in those terms.
Okay, so who do you think can create those guidelines and kind of those that overarching governance? Does there need to be another organization that's going to connect them?
No, not at all. So yesterday, you heard from Don and I, and our teams have been talking about implementation guidance that we jointly publish, which is what it should be. It's the standards body saying this is how you can use these standards together to best effect.
Okay, I will definitely chase you on when
those are ready. Hold me to account on this. That's good. I like it.
You often get invited to talk about AI as well.
Yeah.
And good data is the prerequisite of good AI.
Yeah.
It's as you like to say, AI is what it eats.
It is what it eats. If it eats bad food, right? Even the best AI is not going to perform well. So one of the reasons I came to OpenEHR was having tried to implement AI and found the huge issues with data. So for me, I'm doing this because it's the foundation to the next generation of healthcare solutions.
You were recently also in the United Nations talking about AI. What do you see as the importance of discussions on that level? To which extent are these discussions too far from what's happening on the ground?
So we need discussions at all levels, but unless we have international standards around some of these things, so I'll give you a simple example. The European food label for what's happening in an algorithm, that's something that we've talked about at CENT 251. And those things we need at either a, say, European level or an international level. So talking at the UN about the common things we need globally, which are around standards, that's really important because the standard space is yet to fully develop.
We could talk for a lot longer, but I think we just created a little bit of a traffic
jam. We're holding up the traffic.
We need to go back to the conference, so thanks.
See you later, and thank